Welcome to this bonus presentation for Winter 20 Release Readiness Live. I'm Elna Miller, and I'm here with the team from Health Cloud, who are ready to share the latest new features and enhancements. We may be making some forward-looking statements, so just as a reminder, please make your purchasing decisions based on currently available functionality. And with that, why don't we do a quick round of intros and then we'll get started. Bala, why don't you go first?
Thanks, Elna. Hi, everyone. My name is Bala Subramanian. I'm part of the Health Cloud product management team. Really excited to be talking about a number of new features today that are coming out with our Winter 20 release. Within the Health Cloud team, I focus on our solution for medical devices. And again, like I said, really excited to be talking to you about this today.
Hi all, my name is Matt Yo. I am a product manager on the Health Cloud team. Again, my area of focus would be on life sciences organizations and what they're doing in that space, as well as I'm here to talk about care programs and enhancements that we're doing to its care programs. Happy to be here. Over to you, Manish.
Thanks, Ella. My name is Manish Jayandani. I'm a part of the product management team here at Salesforce. I've been at Salesforce for almost 7 months now, and I'm really excited to be here to be talking about a new product that we are launching in the Winter 20 release. It's called Einstein Analytics for Healthcare. Back to you.
Oh, I can't wait to hear about that. Okay, so let's get started, Bala, and I think you have some new information to share about provider relationship management, so
Sure.
take it away.
Thanks, Elna. So I'm going to be talking about provider relationship management, which is really a solution that is focused on payer organizations as well as medical device organizations. So if you look at it, the foundation of a provider relationship management system is really the comprehensive provider data model that we provide in Health Cloud. So in this data model, you can really represent, as a payer organization or as a medical device organization, your customers and your parties that you interact with in terms of both their operational information, such as what are the locations that they practice in, what are the operating hours, and so on, as well as the business information related to the licenses, the education and certification levels, and so forth, as well as the medical specialties and subspecialties that these providers are certified in. So all of this information together is what we call our provider data model. It's a very comprehensive data model, and it gives you that 360-degree view of the providers. So this is something which was the provider data relationship management data model was part of our summer release. And what we are doing in the winter release is really building some capabilities on top of this foundational data model. So the first of those capabilities is what we call our provider visualization. So again, if you think about that comprehensive provider data model, there's a lot of information in there. And it's very important for users to be able to quickly access all of that information. So one of the features that helps you do that is what is called a provider relationship card. This is nothing but a component that can be added into, say, an accounts page or a contacts page, and it gives you that 360-degree view of all the related entities to that account or contact. Not only can you see those related entities, you can also see all the different attributes that relate to that entity. So as an example, suppose you add the provider relationship card, say, to a contact page, you will be able to see all the different accounts that that contact actually has a relationship with. So in the case of a healthcare practitioner, you can see all the different hospital locations that the practitioner is actually practicing at. In addition, you can also see all of the related attributes of that practitioner at those different locations. So for example, a doctor may have a certain set of specialties that they only practice in certain locations. So you can see all of that as part of these provider relationship cards. There are 4 different cards to choose from, and that is something that you configure as part of your setup. The next feature that is really built on top of the provider data model, which is a key part of our provider relationship management solution, is provider search. So as a payer organization or as a medical device organization, you can enable provider search both for your members as well as for your internal employees, which could be sales reps or which could be contact center employees. So some of the capabilities around provider search are the ability to perform a location-based search, where you can search for providers that meet certain criteria within a certain radius of a location. You can search based on their network status, for example, whether a provider is in-network or out-of-network relative to a certain plan type. You can visualize the search results on a map that is interactive, that you can zoom in and zoom out of. And lastly, you can also enable provider search within a communities page. So then that communities page is something that you can make available to your members as well as to your patients in the case of a provider. So next, let's do take a quick look at a demo of these two capabilities. So what I'm looking at here is the provider search page. This is a page that can be added as a home page as well as a record page within an account, which means that if your accounts represent your patients, you can essentially have this page nested under your patient page so that when you search for providers, you can also see which of those providers are in network relative to that patient. So what I'm going to do here is select I'm going to search for providers that accept a PPO plan type and that are within a certain radius of, say, an address. So I'm going to give an address, which is 50 Fremont Street in San Francisco, and look for providers that accept the PPO plan that are within 100 miles of that. So as I'm searching, I can see that all of the results are returned here, and I can also see the results that are laid out in a map. In addition to this, I can, let's say, filter the search results. So suppose I want to just see the providers that are accepting new patients. I go ahead and click on the accepts new patients and repeat that search, and now I see that there are 2 of these providers that meet that criteria. So as part of the information that I see related to these providers, I can see the name and the address, the operating hours, as well as information about the different specialties that they have, the plan types that they accept. And as I filtered on only those that are accepting new patients, I can also see that information returned right here. So that is, in brief, the provider search. As you can see in the search panel, there is a set of fields that you can search on, including some that are in the advanced section. And this really, again, helps you come up with a targeted list of providers, whether you're searching as a member or a patient, or whether you're an internal employee, say a contact center employee that is responding to a customer service call from a patient or a member, and then you want to search for providers that are applicable to their needs. Next, I'm going to go to the contact page for one of these contacts. So this is a practitioner called Gayatri. And if I click on the provider relationships tab here in that contact page, what I can see are 5 different relationship cards that are shown. So what these cards represent are the affiliations of this healthcare provider with different facilities. So this particular provider called Gayatri is practicing at Great Health Clinic and Bay Care and Peninsula Care and so forth. So you can see that, but you can also see related information of that practitioner at each of those facilities. So you can see, for instance, the specialties that this practitioner has at those facilities, the different NPI numbers of the facilities, and of course, operational details such as the address, phone numbers, and so forth. So this is, again, a very powerful feature because without a relationship card, you would have to navigate through related lists and so on, and really go through a lot of different clicks to get all of this information in one place. So I'm going to now talk about another set of features, which is the sales agreements and account-based forecasts. So these are a set of capabilities that are focused on our medical device customers. So let's first talk about sales agreements. So a sales agreement is nothing but an agreement that you as a medical device company would enter into with your customer, which would be, say, a hospital system or a medical group, or in general, a healthcare practitioner. And this agreement relates to the sale of medical devices into that account. So what you have as part of that agreement is a statement of a planned volume of product sales at a certain agreed upon price. You can add discounts into that agreement, tiered pricing, and so forth. You can also incorporate your forecasts into that agreement. And the main business benefit of these sales agreements is the fact that on an ongoing basis, as a business, you can track the compliance to that agreement. So as your customer, which is the healthcare provider, is placing orders against that agreement, in a single integrated view, you're able to see how are they tracking towards actually meeting the terms of that sales agreement. So on an ongoing basis, it really helps you enforce the agreement and avoid revenue leakage, and make sure that you're getting the maximum benefit that you can through that agreement that you entered in with that healthcare provider. The next feature as relates to our medical device customers is the feature called sales forecasting. So think of this as a way of predicting your business volume on a forward-looking basis. So as a med device company, as you're selling these products into healthcare providers, you want to be able to forecast your sales volume as well as your projected revenue. And with intelligent sales forecasting, you get a very intuitive and easy to use UI where your sales reps and your sales teams can go in and really lay out a statement of that forward-looking sales projection. This is also a very collaborative environment, so sales teams can also collaborate on specific numbers within that overall forecast. There is audit trail that can be enabled where you can see when numbers changed, who changed the numbers, and so forth. And the main benefit of sales forecast is that it really provides your company with that single view into what is the business volume, and really it also helps to align with your upstream processes such as supply chain and so forth. And just as with the sales agreement, with the forecast as well, you can always keep track of actuals and then compare your forecast to the actuals, make adjustments to your forecasts as you move forward. So now let's take a quick look at a demo of sales agreements and account-based forecasts. So I'm looking at this account called Great Health Clinic. And as part of the related list to that account, I see that I have a number of sales agreements here, which I have already created. And I can drill down into one of these sales agreements. And in the Details tab, I see some key parameters related to that agreement, such as the start date, the frequency of that agreement, which represents the time frequency at which you're tracking, the number of months in that agreement, and so forth. And then once I go to the agreement terms, this is really where the heart of it lies, where at a product level, I can see what is the planned quantity that my customer is committed to. I can also look at actuals which are coming in so that I can track my actuals against my plan. I can also look at what is the sale price that was agreed upon, any discount that was agreed upon, and what that means in terms of a projected amount. In addition, as part of my sales agreement, I can also add in custom metrics. For instance, here, as part of these different products, which are stents, I have added in a custom metric called last year's procedure volume, which really helps me see how much of market share I'm getting with this particular account relative to the total number of procedures that account has performed, say, last year. So that is an example of custom metrics that can be added into sales agreements to really give you a very business-specific view of how you want to track that agreement. So moving on to account-based forecasting. So if I go back to my accounts page, I see that I have a forecast tab. And within the forecast tab, I have my account-based forecasts. So here, one of the benefits of account-based forecasting is I can commingle both opportunity-based tracking of the business as well as a throughput-based tracking of the business. So I can combine both of that into a single statement of what my forecast is at the account level. I can also have last year's actuals represented in my forecast and really calculate that forecast as a function of last year's actuals. As I make changes to my forecast, I can see that it's indicated visually here. And when I click into any change that I might have done to that forecast, the system also tells me what was the value that was actually calculated by the system based on a formula, and then what is the number that I actually changed it to, as well as some notes that I might have entered as I made the change, saying that, for instance, I expected a large order in November, which is why I actually made the change. Now, in terms of the different formulae that you can have to drive your forecast, as part of setup, you can look under account forecasting, and you'll see that in the formula section, I can specify different types of formula that I can use to calculate my baseline forecast. Again, this is just a baseline. As a user, I can always go in and change these numbers as I get more insights and information into the specific account that I'm forecasting for. There is a formula editor as well, where I could go in and basically compose my own formula to calculate my baseline forecast. So the last feature that I'm going to cover is called person life events. So essentially with Health Cloud, you can now track key life events that relate to your customer, who could be a patient or a member. So these are events which essentially influence your interaction with the member or the patient. So you can create these life events. There is also a lightning component that can be added to that person account page, that as a contact center person, you can have visibility into that as you're having your interactions with the members and with your patients. So with that, that concludes my section that I wanted to talk about, which is really around the provider relationship management, sales forecasting, and sales agreements and person life events. I'm now going to hand it to my colleague, Matt, who's going to walk you through the next topic that we have in Health Cloud.
All right, thank you, Bala. All right, hi guys. I'm really excited today to talk about what we're doing for life sciences organizations in the context of a care program. And just a quick recap of what we released in the summer release. We released a care program data model, and it's used to sort of help life sciences as well as Health Cloud healthcare customers sort of scale, manage, and plan their care programs. The one thing that we understand that is really important is for patients to participate in care plans, to sort of keep track of the way they stay in tune with their health outcomes. So in this winter release, we decided to introduce a new entity called Care Program Plan Templates that would tie a care program to a care plan template. All right, so in the winter release as well, since we sort of have this foundation for a care program, what we wanted to do was to create a lot of efficiencies in the enrollment process for you to enroll a patient into a care program. So one of the things that we're doing is to provide what's called an enrollment flow template. The way the enrollment flows template it works is that we're leveraging our flow infrastructure, and we're shipping the program enrollment flow template together with your Health Cloud licenses. All right, so one of the things that is also really important for this is to be able to obviously this is a point of view to be able to walk you through the actual enrollment flow itself. So let me just take a minute here and sort of dig a little deeper into the enrollment flow itself. So we're going to start off with actually finding the right care programs, followed by selecting the right products and services that roll into that care program. The next thing that we're going to do is actually find the providers that are related to those products and services that you're going to be providing, as well as the ability to review that information before you enroll a patient to the program, and once you complete the enrollment, to be able to either capture consent or not capture consent as part of this process. Again, this flow can be leveraged across either a patient services support rep in a contact center, or it can be done on in person as a care coordinator. All right, so let's take a little closer look at the enrollment flow itself. Again, the goal here is to reduce clicks and errors by providing a guided enrollment flow. You see, as well as the screenshot shows you a split screen view for the care coordinators to be able to view details around the care programs themselves. We also wanted to set up and streamline the approach to setting up the care programs. So what we have done is provide a flow that will respect the org preferences, configurations, as well as page layouts and views and sharing processes within the org. All right, view forms and consent forms is an interesting feature that we're releasing in the winter. This will allow, and you can include the enrollment consent forms as part of your enrollment flow itself, or you can make this available to patients and care coordinators as part of a community component. So we want to make this really easy to use so that your patients will be able to view the forms if they were not in person, to be able to complete and provide their consent on these different forms during the enrollment process. All right, so e-sign, and I'm really excited to announce this new feature around e-signature. The e-signature component is a much asked feature from our customers to include that as part of the enrollment process that we are releasing in the winter. This again will be available to as part of the enrollment flow or through the patient community. But before, and you'll see this in action when I run through the demo, but before I do that, let me just take a minute here to talk about our consent entities. All right, so this is the consent data model that we, this is not a Health Cloud feature. This is the platform consent entities that was introduced in the summer of this year. And what Health Cloud is doing is leveraging the consent data model by tying our care programs to a data use purpose entity, which rolls into the consent data model. And we would record a authorization form consent record every single time consent is provided during the enrollment process. All right, and lastly, this is more of just for awareness. In order for you to set up consent against a program, make sure you populate the right consent entities, and also to ensure that you set up the right documents in Salesforce files, set up the right sharing, and tying that back to the authorization form text entity as part of the consent data model. Lastly, what we're doing is we're extending the existing care program community component to include the ability for patients and caregivers to view consent forms and to be able to action off these forms, as well when they log into a customer community, whether that's on their phone through a mobile device or through a desktop. All right, so what I want to do next is walk you through a demo. All right, I'm logged in here into a Salesforce org for Makana Health Pharma Company as a patient services support agent. So Mr. Charles Green over here is a patient. He had just visited his physician, and his physician has provided a enrollment card that says, call this number to get enrolled into the support program. And so he calls in, and the patient services support rep gets a screen pop of his information, and now he's ready to get enrolled into the program. So the first thing they would do is, through a quick action, the patient support rep would click on Enroll in Program. And again, this is a guided process. So the patient services support rep would find the information that Charles Green had provided. And in this example, we're going to use the Kanaka Patient Support Program. And as you can see over here, there's a split view that shows you all the information related to that care program, and including all the criteria and eligibility requirements for you to get enrolled into the program. So the next step, as part of this enrollment flow template, is to be able to find the products and services related to this specific care program. So in this case, there's only one product, the Zambian product that Charles Green can get enrolled in, so we would select that, click the next button, and then the list of providers would be selected based on the area that Charles Green lives in. And we would select the provider as well. And the final step here is to review that information to make sure that the patient services support rep has captured all the right information related to the right programs to be enrolled into, and it would click Enroll. So it's because there is actually two different personas in this case. In order for the patient to complete the enrollment process, they will need to log into a patient community to be able to provide their consent, read a list of documents, and then complete the enrollment process. So the next thing I want to do is I'm going to change gears a little bit to kind of show you what a patient would see when they log into this community. So what the first thing you'll see is that there's a new program that shows up as part of this patient community component. And it also tells you there are some forms that needs to be filled in as part of completing the enrollment process. So the patient on their mobile device, and this can be made available in a community on mobile publisher as well, so the patient actually have an app they can go into. So they would just click on this link that would take you to a list of forms that this person would essentially view. The first form sort of shows up. The patient goes through the form, reads the form, and clicks on the consent button to provide the consent. For this specific document, it requires a signature. So the patient would essentially sign on the dotted line to provide his signature as a form of consent, and it would click Done. And you notice here that that information gets captured for this specific document that requires his attention. The next thing Charles would get would be a second document that he'll have to read through to be able to provide his acceptance and consent. So Charles goes through this document again and clicks the Accept button to complete the enrollment process. So this concludes my demo for today. So I'm going to hand this over to Manish, who's going to talk about Einstein and Health Cloud.
Thanks, Matt. Awesome overview. So I'm really excited to talk to you about Einstein Analytics for Healthcare. It's a new offering that we are launching in the Winter 20 release. So let's get going. So what is Einstein Analytics for Healthcare? Like I said, it's a new solution that we are launching in the Winter 20 release. It's a complete, comprehensive, actionable, intelligent package for healthcare. And what we have done is we've built this application based on feedback that we've gotten from our customers, based on industry experts. And this application includes built-in reports, analytics, metrics, dashboards that are based on these advice that we've gotten from industry experts as well as customers. So with this application, both payers and providers can benefit from this application, and it has use cases that we'll talk about a little later. And the beauty of this application is that it's completely built on top of Salesforce Health Cloud. So if you are a Salesforce Health Cloud customer, you can take advantage of this starting today. And this is also deeply integrated into the core Salesforce platform. So which means that if you want to drive actions that you gain from these insights, you can take actions, you can go into the transactional application via bulk actions and set up interventions for your patients or members as well. And the insights that you drive from this application are across all your, across the entire spectrum, from strategic to tactical to operational as well. And the last part that I want to talk about is that the application is completely extensible and customizable. So you can go ahead and change the metrics, change the dashboards to meet your business requirements. So let's talk a little bit about the use cases that we are launching with this first release of the application. So with the first release, we're going to focus on 3 core areas. So if you're a payer, Utilization Analytics is the module that you will leverage a lot of. It enables you to focus on your entire care request process. And the goal with this module is to give you visibility into that process so that you can drive actionable insights to improve this process, understand what the process bottlenecks are, and the end goal with this is to ensure that you are adhering to the SLAs that have been established, as well as ensuring that based on those SLAs, you're driving better customer satisfaction, as well as improving your overall NPS as well. If you're leveraging the care plan module from Health Cloud, care performance gives you visibility into how these care plans are working. These are the care plans that you might have established for your patients or members. And with the care performance module, you can drive visibility into what patients are adhering to these care plans, which patients are falling behind. And with these insights, you can then follow up with these patients, set up interventions, and also the goal is to avoid preventable admissions or prevent readmissions as well. Lastly, we also have a module around referral analytics, and this gives provider networks visibility into how their new patient acquisition process is working. So with this module, you can gain visibility into your top sources of referrals, what referrals are getting rejected, gain visibility into that so that you can increase your patient conversions. So from a persona perspective, as I mentioned, the application is specific, delivers value to both payers as well as providers. So based on which spectrum you are on of Health Cloud, you can be a payer, and from a payer perspective, if you're a utilization manager or a care manager, you'll gain value from these use cases. From a provider perspective, care coordinators or medical directors or physician liaisons who work on referral management modules would be the ones who will gain benefit from this. So let's talk a little bit more about care management. So from a care management perspective, like I said, we have built a set of reports and dashboards that focus on giving the care coordinator visibility into how patients are doing when it comes to their care plans. So if I'm a care coordinator, I really care about, I am focused on ensuring that my high-risk members are keeping up with their care plans. I want to understand what care plans are working, which ones are not working. Based on that insight, I then want to set up interventions for these patients to make sure they're going back on track. And then the end goal for me as a care coordinator is to ensure that these patients are not falling behind, and as a result, they're not getting readmitted after a procedure, for example. The second use case that we want to talk about is utilization management. And with utilization management, utilization managers at payers can gain visibility into the entire care request process. They can understand the operational efficiency, what are the process bottlenecks, and the end goal effectively for them is to improve the customer satisfaction and also the NPS as well. So as a utilization manager, by leveraging utilization analytics, I can look into what kind of care requests are coming in. I can segment the entire process to gain visibility into that process. So for example, if I'm getting a lot of requests around admissions, I want to make sure that as a utilization manager, I have enough certified nurses on staff who can take the demand and make sure that we are staffed up to meet those requirements. I can also look at operational efficiency. So if we are falling behind in adhering to our SLAs in how quickly we are approving these care requests, I can drive visibility into that and ensure that we are not falling behind. And again, this will overall give visibility to utilization managers into understanding what are the most used plans or benefits that members are leveraging. Lastly but not least, for referral analytics, for a lot of the provider systems, new patient acquisition is a very key business process. That's the business process they leverage to get new patients into the network, and also new patients that are coming from out the network. So understanding who their top sources of referrals are in terms of referring organizations or referring physicians is very, very important so that they can engage with them at the point of contact, as well as understanding how quickly they are able to push these new patients through the process, and getting them an appointment booked is very important as well. So with these set of reports and dashboards, you can understand how long a patient has been in, for example, in the referral management process, drive that visibility to ensure that they are getting the entire attention. They're getting the requisite attention to make sure that they're getting to their appointments. That means that they can get timely care as well. Last but not least, we also have embedded analytics, and these are contextual analytics that are in the context of, for example, the patient record or the referral management module, where if I am a service agent, I can get contextual insights about these patients so I can drive engagement and understand what's the cause of the process not moving, for example, the referral process not moving as desired. So with that, let's jump into the demonstration and see what this application looks like. This is the home page for me. This is the kind of the tee-off point where I can gain a quick at-glance visibility into how my care plan's doing, how am I doing in terms of my utilization management, as well as referral analysis as well. So let's jump into care plans, and I can see that as of today, there are about 27 care plans that are behind schedule, and I need to kind of ensure I want to understand what's going on to make sure I can set up the right interventions for these patients. So I'm going to jump into a care plan adherence dashboard that gives me visibility into a member profile by risk. So over here, I can see different risk profiles. I can see there are a lot of goals and tasks that are overdue. I can also then drill down and look at, for example, any high-risk patients. And for this specific patient, I can see that there are multiple goals and multiple tasks that are overdue. And again, because we are built on top of Health Cloud, we can quickly navigate to the patient record, and I can set up the right intervention, a follow-up call, or an appointment to figure out what could be going on with this patient, so I can make sure that they are staying on top of their care plan and ensuring that they are not falling behind. Then I have also visibility into, for example, member details. So if I want to look at, example, my entire member population and see where they are at in terms of their different tasks, and look at that profile by insurance and risk, this dashboard gives me a quick overview of the different members that I'm responsible for, how many problems are they face, how many problems have been opened by them, the number of goals, the number of tasks, and I can see that split by insurance providers as well. Lastly, from a care performance perspective, I can again look at members who have their care plan tasks open for a long period of time. I can slice this information also by the priority of the request. So for example, if I just want to look at high priority requests that have been open for like 9 days, I can look into that. And again, I can navigate into the Salesforce record to take interventions for this specific patient. Now let's look into the utilization analytics module and see how, as a utilization manager, I can drive value from this module. So I'm going to go back and going to first start off by looking at care request. So this dashboard actually gives me an insight into different care requests that have come in, and I'm looking at a slice of that information by the different clinical case types. I can again over here look at metrics such as how many care requests have come in, what's the average resolution day, that looks pretty high, and then I can also see how many of the care requests that have come in have actually breached their SLA. Now, this is a very critical metric for me because as a utilization manager, I want to ensure that we are responding to these care requests on a timely manner. So that definitely is worrisome. So in this case, I can actually, if I want to look at, for example, transplant, that seems to be the category where a lot of these care requests are falling behind. I can quickly slice that information down and leveraging the bulk action framework from Salesforce, create a list for me, and then set up follow-up action items so I can follow up with these members who have filed these care requests and understand what could be going on. Then a different slice of this information around is by the different kinds of care requests I'm getting. So in this dashboard, I'm looking into, for example, a different kind of care request. So I can see that I have different care requests coming for admissions, for different service requests, and even concurrent review. And this information is also split by different clinical case types. So I can see that there are, so I can understand what are the top requests that are coming in, also by clinical case type, so I can ensure that I have the right amount of people, certified nurses, who can then intervene and make sure that we are processing through these care requests as quickly as possible. The last dashboard that I want to talk about is around the denied care request. And again, as a payer, this dashboard gives me critical insights into trying to understand why care requests are being denied. So over here, I have key metrics around the process that tells me what's the percentage of the overall requests that we have got. We decline about 27%. That's pretty high, and how many are getting reopened as well. And over here, I can see that there are a lot of care requests that come in that says that the member information is not found. Now, from a care request management perspective, I want to make sure that we are we can cycle through these requests as quickly as possible. So if a member request is not found, I want to follow up with these providers or members and ensure that they are following due process to ensure that they provide the right information about the members, so we don't see these kind of denials as well. So let's flip and let's look at, for example, reopen cases. And in this case, that we see that we have a lot of cases that have been reopened because there was an administrative error. So again, from a payer perspective, these are clearly avoidable circumstances where if we had the requisite information available, this process would move along much, much faster, and ensuring that the members that have filed the care request are getting care in a timely manner. So with that, let's just switch gears and look at referral analytics. And over here again, I can look at the number of referrals, the new patient referrals that I've gotten, and how many are open today. So top referrals dashboards gives me visibility into the top sources of referrals. So in this case, I can see this information by different insurance types, practitioners, different organizations. On top banner, I have information around the metrics of how many referrals we have gotten, how many we have converted, what's the average days, min days, max days. And this again gives me visibility into how efficiently the process is working to acquire new customers, new patients. Converted again gives me the same information, but by how many new patients have been converted into patients, and equally important, rejected, because if I see that there are certain kind of insurance types that are getting declined, I want to understand what's going on so I can improve this process and get more patients into the network as well. Lastly, I can also slice and dice this information by whether these patients are out of network or in network to drive that additional detailed insight into this process. Then I can also look at the referrals by ages. So over here, I can see that there are about referrals that have been open for almost like 40 days, and there have been different stages of different stages. So in this case, if I want to see how many have been contacted and are being worked upon, I can then slice the information by insurance type of service, and specialty, again, making sure that these metrics are aligned with my business goals as well. The last dashboard around referral analytics is around referrals efficiency, and this dashboard gives me visibility into how efficiently the process to convert new patients into patients is working. So in this case, I can look at number of new patients that are there in the pipeline and what stages they are in and how long they've been in that stage. So I can, for example, if I can see that I have almost 83 patients that are in that bucket, and they've been in that bucket for like 32 to almost 30 plus days, that clearly is a sign that I'm not pushing them quickly enough through the process. Last but not the least, this is the dashboard that gives me visibility into, once I have a new patient, how quickly am I able to take that new patient and get them to an appointment, which means how quickly am I able to give them timely care. That is also very important from a provider network perspective, and this gives me visibility or insights into that process to understand let's focus on patients that are kind of have been in the stage for a long time, so that we can move this along as quickly as possible. Lastly, I want to touch and talk about embedded analytics, and this is an area where I think we have done good innovation in a way that in this scenario we are getting a lot of information that is contextual. So let's say if I'm Ananda and I'm calling into the payer, and as a service representative, I can quickly look at embedded analytics that gives them insights about this patient, and I can see that this patient, for example, has an appeal care request and a grievance care request that has been open for a really long period of time. So quickly I can, when the patient is calling in, I'm sure they're going to talk about this care request and what's going on, so I can engage with the nurse practitioner to understand what's going on and why we have taken such a long time to address this person's care request. Lastly, also want to talk about another use case for embedded analytics, where in this scenario we have embedded analytics in the context of the new patient. So here we are looking at a patient record that has been through various stages of the process, and over here I'm getting information such as what is the probability of this, how many of these patients have we converted when we have specialty cardiology. So that gives the physician or the referral coordinator contextual insights about how much effort is required to convert this patient. One more thing that we want to talk about is this also gives visibility into whether the referral coordinator has given enough attention. So we are looking at how much this patient has got, how many activities has this patient got in comparison to all the other patients as well. And clearly we have flagged this as behind, which means that as a referral coordinator, I want to go ahead, engage this patient, maybe call them up or send them an email so I can get them into a booking as quickly as possible. So with that, I would like to pass it over back to you, Elena.
All right, thank you for those updates. There's a lot of great information, and one thing I noticed is it's really nice to see how the analytics integrate so seamlessly with this, industry-specific business functionality that's in Health Cloud, and it all works together. And I'm just thinking about the amount of time that would save for someone who was maybe building this from scratch in a platform, for example, a Salesforce platform where they're starting from basically having to build the whole thing. So
absolutely, I think that's one of the key value propositions that we have with Einstein Analytics for Healthcare. It's a pre-built application, which means that you are, as a customer, you're leveraging the insights from industry best practices as well as other customers. It's all baked into the platform, into this application. So you leverage that. You also have a time to value. So because this is pre-built and connected into Health Cloud and Salesforce, as a customer, you can be up and running much faster rather than if you're trying to create this themselves. And lastly, it's also extensible and customizable. So if you want to take this platform, take this application, add new insights or modify certain insights to meet your business requirements, you can do that fairly quickly.
So what if you're not already a Health Cloud customer? Could you use Einstein Analytics for Healthcare?
So I think one of the key requirements for this application is for the customers to get the maximum benefit or the value from this application. You have to be a Health Cloud customer to get maximum benefit from the application.
And that's maybe because it's integrated with certain objects and things that you might not have created. So
absolutely,
the data might not be there if you're using a different setup. Right. So I got a couple of questions for Bala, so we can go back to you real quick. So when you were talking about the comprehensive view of healthcare providers, why is it important for payer and medical device organizations specifically to have that functionality?
So if you look at it like payers and medical device organizations, their customer is the healthcare provider, right? And if let's say you're a medical device organization, you can really tailor your sales strategy based on attributes of that provider. For instance, what are the different specialties that they have? What are the hospitals that they practice in? And that kind of specialty information, potentially what kind of insurance plans that they accept, which could determine whether you're going to sell them a higher end product versus a lower end product, and so on. There is also procedure information. For instance, how many procedures of certain types that they performed, say last year, that can also influence your sales strategy. And the same for payer organizations as well, when they are assessing things like network adequacy. So do they have enough providers of certain specialties in certain geographies? Having all this rich information really helps get to those answers very quickly.
And flipping over to the provider search capability, what are the advantages to using that versus, let's say, other alternatives?
Yeah, so that's a good question. So the way that we have built the provider search in Health Cloud is it's really closely integrated with the CRM system. So a lot of companies, what they do today is they have their CRM system, which their contact center agents use when like a patient or a member calls in. And then they have like a separate system which they expose to their patients on their websites to do search and so forth. And there are a lot of latencies between these two systems, as well as it's very expensive to maintain a separate data repository just to serve your search needs for your members and your patients. So that's the problem which we really addressed with Health Cloud, is we have offering that integrated system that can serve both your internal CRM needs as well as your customer-facing needs to really surface up these search capabilities to your members and patients.
Dual purpose and one system for dual purposes.
Yeah, just do it once and solve two problems, right?
Definitely, I can see the efficiency there. So now pivoting over to the sales agreements. So can you just describe how they help reduce revenue leakage on your key accounts?
Yeah, so this is something which when we spoke with a lot of our customers as we built this feature out, one of the biggest pain points that they had was they could enter into these agreements, but they had no way of actually tracking these agreements. So that is the problem that we set out to solve, is to say that we'll give you this way where you can really detail out what is in the sales agreement in terms of the volumes, the discounts, and the prices, and so on. But then most importantly, we'll give you this easy way of actually tracking to that agreement, to making sure that your customers are ordering the product in compliance with what they agreed upon as they entered into that agreement with you. So, and that is the big source of helping medical device companies really get the maximum bang for the buck in terms of these agreements that they enter into with their customers.
I see. Well, that makes a lot of sense. Well, thank you all for joining me today, and thank you for watching. I cannot wait to hear how you're using new features to innovate, so let's keep the conversation going in the release readiness community. I believe there's also a Health Cloud group in the Trailblazer community as well. And really, the community is where all Trailblazers can meet to be release ready, so we'll see you there.